Sharon. I'm one of the midwives of the Ask a Midwife service, and I've got my colleague here, Sharon.
Hello, hi, I'm Dr. Sharon Fan. I'm one of the consultants in Hull Hospital.
Right, Sharon, we get certain questions through the Ask a Midwife service, and one of the main questions we get is about induction of labour. Can you tell us a little bit about the induction of labour process?
Yeah, so induction of labour is essentially us kicking start the first stage of labour, the latent phase of labour for the women, it could be for a variety of reasons, and everyone's different, and every unit has slightly different guidance and thresholds, so I can't give you specific dates, weeks and reasons, but it's essentially us ripening the neck of the womb, the cervix, to try and mimic the latent phase of labour. And then what we're aiming to do is break the waters and get contractions going and get the labour going.
So it's not actually trying to get you into labour then?
It's not. No, and I think that's quite a common misconception, is that some ladies, they think that they've been in labour for days, but unfortunately it's just the beginning of it, and the whole process is the ripening of the cervix.
Right, okay. So how do we go about ripening the cervix?
So again, every unit does slightly different things. So I've bought, just like Blue Peter, I've bought different things today. So with the balloon induction, what we would tend to do is we will put this plastic tube that goes in through the neck of the womb. This is it, not inflated, and this is what it looks like once it's inflated. It looks quite scary, but it's not painful. It's just quite uncomfortable. That is all. And it basically pries open the neck of the womb in a mechanical sort of way, like you would do if you've ever had a stretch and sweep, for example. And it basically tries and separate out the membrane, which is the water around baby, from the neck of the womb. And that will stay in for 24 hours. So ladies in Hull get this very routinely. In certain units, I know that only certain ladies who've had previous cesarean section will get this as well. So different unit use it differently, but this is usually our first port of call.
And would they need to stay in hospital if they have that?
No. So the good thing about this is that you go home with this. So it might look a bit silly. You might feel like as if there's something hanging out, but it's actually, once it's in, they do get a little bit of crampy pain that lasts for about 6 hours. But then afterwards, you would just feel a bit of pressure. And what we want you to do is to go home with it, so that you're at your most comfortable. You're walking around. You're looking after your other kids, chasing everybody around, doing your own thing, because that's where your normal, the syntocinon hormones, your happy hormones are there to try and stimulate labour.
Are women able to have a bath with this in?
Yes.
Right, okay.
Yes, they can. It does feel, whether or not you want it's comfortable to sit on, I'll leave that decision up to the ladies themselves, but it's absolutely fine. But we would avoid sexual intercourse with this one.
Okay. So if this doesn't work, what would we do next?
So again, every unit, they do things slightly bit differently. So quite often they would use what we call a propess. So this is what I call, it looks like a little tiny tampon that goes in through the vagina and around the neck of the womb. And what it does is stays there for 24 hours and it releases hormone that's naturally occurring in your body. But what it does is it delivers it in 24 hours to help soften the neck of the womb, and it can make the vagina quite irritable in a way, so it can be quite uncomfortable when ladies have this removed and then they have vagina examination. So always do tell ladies that beware. It does make it more uncomfortable, but it's there to do the job.
Okay. Would they need to be in hospital to have that?
Yes, they would. Yeah, they would need to be monitored via CTG, which is to monitor baby's heartbeat and to just check for, because what this can sometimes do is cause a bit too much tightenings, and that can sometimes cause stress to baby as well. So that's why we do advise keeping them in.
Okay. So what would be the next stage after that?
The next stage is, in some units they use gel, but I don't have any gel at the moment, so I do apologise. But we've got a tablet. So these tablets, it goes in for 6 hours and you can have 2 rounds of these tablets. Again, every unit is a bit different, so it really depends on which unit you are being admitted to and which process they've decided to go for in their unit.
Okay, so after we've done all of this, if the cervix is still not ripened, then what would happen?
Then what we would do is we would discuss with the lady themselves as to what it is that they want to do. Again, every unit have different guidance of what happens if the medication doesn't work. In our hospital, we do give them a day of rest. However, we do speak to the lady, see how she feels, see how baby is. We do keep a close eye on baby and mum as well, and then they can decide to continue with the induction process, and also, or they can opt for not continuing, or they can opt for cesarean section as well.
Okay, so once the cervix is at the point that we could break the waters, what would happen then?
So it's a case of waiting. So we can't break the waters in an antenatal ward setting. It's not safe because we need to continuously monitor baby. So what will happen is that once we can break the waters, labour ward, in all units it will be labour ward who takes the women and breaks the water, usually start them on a hormone trip. In some units, we do give quite a lot of time for maybe 2 hours to see if they've had previous vaginal deliveries in the past. We might be able to give them 2 hours where they've had the waters broken. We get them to mobilise, get on the birthing ball, to be as active as possible to try and bring on the labour as well.
One of the questions we've been asked on the Ask a Midwife service is if they've had the balloon, are they able to then go on to the midwifery-led unit if that is part of that hospital service?
So it really depends on the reason why they were started to be induced. So for example, if some ladies who have had a balloon inserted, induction process started because they are over the due date, then there is a potential that if they've had balloon inserted, they can. But if it's anything to do with baby being small or concerns about baby's growth, then that's not something we would routinely recommend. But again, it is all about patient's choice and what we would do, and that's something that we've discussed in our other video.
Okay. Thank you.
Yeah, you're very welcome.